We called this project Tycho because we named it after Tycho Brahe, the Danish astronomer who mapped the movements of the stars and the planets. His assistant, Kepler, came along and used these data to derive the laws of planetary motion. We hope that there are epidemiological infectious disease Keplers out there today who will be able to use these data to derive important laws, important insights into how epidemics arise, how they move, how they interact. And when we do this development of computer models, we need to go back historically and look at the patterns that were there before. Because every time we wanted to create a new model for polio or influenza or malaria or dengue or pertussis, we would go back and pull out historical data. We kept doing it over and over.
And our vision was that not only we, but everybody should be able to use these public data for analysis and their models. And so we worked over the last years to make this into an online system that everybody can use. And the most striking pattern that we saw was obviously these disease patterns, where we saw that diseases were incredibly important around the country, and then all of a sudden, around the time of vaccine introduction, we saw these enormous declines. And so we thought, wouldn't it be interesting to quantify this? How many cases were prevented by vaccination programs in the US since the beginning? And since we had all the data from before vaccine introduction, we could make that kind of estimate. And so we estimated very roughly, actually, for each disease, about 7 diseases, how many cases were prevented by vaccinations, and came to the number of 103 million cases since 1924.
We've now taken this entire corpus of the infectious disease history and made it so anybody on Earth can look at it easily, conveniently, and make sense out of it.
Rather than have individual groups work on these data depending on restricted data access, that access can be now expanded to the whole world, really using more minds together to improve global health.